Hi, I'm Peter Kovacs. I'm the editor of The Advocate and the Times-Picayune, and welcome to our third virtual town hall, today with Governor John Bel Edwards, who's here with us at the GOSEP headquarters in Baton Rouge. Thank you for joining us, Governor.
You're welcome.
We're going to start out with the purpose of this town hall is for the governor to answer your questions that you've sent to us and will continue to send to us. We're going to start out with a little message from AARP, which is our sponsor today. And then I think the governor can tell us a little bit about what happened on the White House call, which he just walked in the room from. And then we'll go with some of your questions. And at the end, Smiley Anders, who is so old that some people think he covered the pandemic in 1918,
yeah.
But he's actually not 120 years old. He might look it, but he's not. He has a couple of special questions for you about some important topics like the chickens and like the tiger.
Smiley only asks about the important stuff. I look forward to it.
So anyhow, let's start out with a message from AARP.
AARP Louisiana would like to thank the Advocate for this timely and important conversation with Governor Edwards. We would also like to thank the Governor for his leadership during this challenging time. I'm Denise Botcher, State Director for AARP Louisiana. AARP is a nonprofit, nonpartisan member organization that's been working for over 60 years to promote the health and well-being of older Americans. Over the past month, AARP Louisiana has hosted several teletown halls with several thousands of its members to share important information, resources, how they can better protect themselves and their loved ones from the coronavirus. It's critically important that together we help prevent the spread. This is a time to remain vigilant and follow the governor's advice. Stay home, stay safe. Together, we'll get through this.
Okay, well, we're thanks to AARP, and we're glad to be here with the governor. And when I tell you that the governor literally walked in here 1 minute ago off a phone call with the White House, that's about right. Yeah. And so maybe he can start by telling us what you learned today.
Well, the purpose of the call was so that the president and the vice president, who leads the White House Coronavirus Task Force, could talk to all the governors. And by the way, I've been doing this for a while now. There were 54 governors of the 55 states and territories participating today, and that's the most ever. And this was about the guidance that they were issuing, that the Coronavirus Task Force was issuing out of the White House to the states about reopening the economy. And the president made it very clear that these are guidelines, things to be considered, but ultimately the decisions would be left to the governors. And some governors will be able to move faster than others because they quite frankly haven't had the kind of cases that some states have had. Unfortunately, we're one of the hotspot states, and we have been since the beginning, and so we have to take stock of that. But these are guidelines that Dr. Birx, Dr. Fauci, Dr. Robert Redfield have all had input into, and they give you things to consider. They phased it into 3 phases, and this actually came out, Peter, while we were speaking, so I can't tell you that I've sat down and really gone through this, but my team is going through it right now to see how it meshes up with what we were already planning to do. One thing we know, and I want to say this at the outset because I think it's always appropriate and important to try to manage expectations. We are not going to get back to normal as a state or as a country until sometime after a vaccine is successful, mass-produced, and used across the country. And so we're talking at least a year and probably longer before we can do that. In the meantime, we have to work on therapeutic treatments. We have to make sure that we open up our economy in a way that strikes the right balance by protecting the public and ensuring the public health. And all these things are very difficult because this is a novel coronavirus, and the scientists, the doctors, the medical community learning new things every single day, which is actually a good thing. Because if we think we know for sure what the situation is going to be 3 months from now, 6 months from now, we're sort of kidding ourselves. But these guidelines are going to be very helpful as we move forward and reopen the economy here in Louisiana. It's again, not going to look like it did before COVID-19. I think you're going to see social distancing with us for quite some time, emphasis on hygiene for quite some time. Sick people are going to be asked to stay home without exception. People who are vulnerable to this virus, so we're talking about those 65 and older and those who have these underlying chronic health conditions like hypertension, diabetes, heart disease, kidney disease, obesity, they're going to be asked to make sure that they're especially careful. And even as we loosen the restrictions, many things are going to stay in place and will look different. For example, I'm not announcing any new policy just yet, but it may be the case, Peter, that when you do finally go out to a restaurant, there won't be a table in close proximity to the table you're sitting at. Your waitress or waiter may be wearing a mask, and more and more often as you enter a building, you're liable to be temperature checked, and if you have a fever, you'll be denied admission. These are the sorts of things we're going to have to do as we open the economy back up, put more businesses back into operation, and get workers back at work. And the other thing we're going to have to do is continue to ramp up our testing and our contact tracing. And the testing is both the diagnostic and surveillance testing for the virus, but also the antibody testing for potential immunity, all of which is very important. And as you test someone and they are positive for the virus, we're going to have much greater capacity to do contact tracing so that we isolate individuals who have come into contact with the individual who just tested positive. Much easier to say than to do, because we're going to have trained workers at call centers who are going to have to do this. And then we're going to have the cooperation of the people that they will actually isolate. The reason South Korea was so effective, and of course many countries have police powers that we just don't have here, but they were able to quickly ramp up their testing and then do the contact tracing and then enforce the quarantine that had to take place. So all of this is going to be done in Louisiana and elsewhere. We unfortunately were one of the largest hotspots in the country. It was about a month ago that we actually had the fastest growth in coronavirus COVID cases, I should say, anywhere in the world. And so we're doing much, much better today, but we still have particular challenges in certain areas like Orleans and Jefferson Parish, where the case counts have been really, really high, and to a lesser degree up in Caddo. But as a state, and really every single region of the state, we are doing much, much better today, Peter.
Oh, well, that's good to know. So is what you're saying, and I realize you just haven't had a chance to absorb this, is what you're saying that we may discover that some measures and relaxations that occur in other states will not be occurring here as quickly, and people will be angry at you as a consequence?
Well, they may be angry, but at the same time, they'll be safer. And most people acknowledge that. This is not a cookie-cutter approach where it's a one-size-fits-all, and the president was very careful to spell that out. We don't like it, but the fact of the matter is we're a hotspot here. We're number 3 in the country in per capita cases. Okay, that's a huge number of cases. It's about 0.5% of our population right now, and you've seen the number of deaths, which today at 1,156 is what we're reporting. But on the good side of that, we're number 1 per capita in testing. We still haven't tested as many people as we would like, and not as many as we're going to have to be able to test going forward. But we are going to do some things differently on a different timeline than other states, and that's just the fact of the matter is, and any other approach would be irresponsible.
Just to follow up on that, to the extent that we're going to see the country as having different rates of removal of restrictions and all that, do you see the state and its parishes being treated differently based on their infection rates?
Yeah, but perhaps not because I choose to do it that way, but you have local officials who have the authority. So, for example, I know that the mayor of New Orleans has already decided that her order for shelter at home will remain in place until May the 16th. By the way, I support that order because that is Orleans Parish is absolutely one of the hot spots in the country, with the number of cases there, the amount of novel coronavirus and COVID-19 that has permeated that community, and this is a high-density population area, relatively speaking, for our state, and the impact that it's had on the healthcare facilities, which are concentrated in New Orleans but serve the entire region of the state. I think that that's appropriate to give a couple of more weeks so that they can have a more orderly transition to something that looks different. And so it may be the case that Orleans Parish is waiting until May the 16th to be able to do some things that happen elsewhere in the state earlier, such as May the 1st. But we're still working with my team to figure out where we are on these guidelines, because there are certain threshold requirements that the White House Coronavirus Task Force says we should meet before we even start the phased approach of reopening our economy. And as we look at those, we took the first look at those threshold requirements, and I say requirements, these are all guidelines, but quite frankly, we don't meet some of them today, but by May the 1st, we could meet all of them. And so we're going to be purposeful about this. We're going to be deliberate about it. And I'm not going to be able to answer questions with the specificity that I would like and that you would like and the people would like for several more days. But understand we're going to move forward as fast as we can do so and maintain the appropriate balance with respect to protecting public health.
Okay, well, I appreciate it. Well, let's get to the questions submitted by readers, and this is our third virtual town hall, and we had one with Representative Scalise and Senator Cassidy, and what was true of those is true of this, which is impressive, is the questions are generally very respectful, and they're detailed, and some of them are a little frustrated, but one thing that maybe this has done is to kind of improve our civic dialogue in Louisiana. Just the threat of it has caused that to happen. So some of these questions are now a little bit obsolete because of today's announcement. But let me start out with, this is from Jennifer in New Orleans. If someone was receiving unemployment benefits before the pandemic, I guess, in other words, if you were unemployed on March 1st, do you get the $600?
Yeah, well, we have people who are manning the phones and so forth to talk specifically, and I'm not sure that I can give a concrete answer just on the basis of that question.
Okay.
But it's my understanding that if you qualify for a single dollar in unemployment benefits from the state, that you then can qualify for the pandemic unemployment assistance and for the expanded $600. But there are always limitations, and I don't know whether one of those limitations would apply to this individual or not. But with respect to unemployment, this is what I want people to understand. And I'm not making excuses, but we're having a volume of people filing initial claims and recertifications, which they have to do weekly, which we have never seen in Louisiana, and this is happening in every state. So I'm asking them to be patient, to do what they can online and between 10 p.m. At night and 5 o'clock in the morning when they're going to have an easier time getting through. And I do want people to know that Louisiana started this week making those $600 payments, and we're one of only 2 states in the nation that were able to do that quickly because the money for the payments just came in last week. But I am asking people to be patient, to call in if they've got questions, to file online if they possibly can. But I would hate to give a definitive answer on the basis of that question and it turns out that because of some limitation that this individual was ineligible.
Okay, this is from Brad in New Orleans. I think I know who this is. To address long-term health care capacity, why can't Charity Hospital be reopened and redeveloped back into a hospital?
Well, first of all, that's a great question because we had 2 imperatives of the first order when this crisis broke out. One was to slow the spread. The second was to surge our medical capacity. And when you surge capacity, there are all sorts of constraints on your ability to do that. With respect to the hospital, it would be an extremely expensive thing to do because it's been sitting there idle. You have mechanical systems and so forth that you have to be able to put back into operation. And when we met with our hospital CEOs, whether it's LCMC, Greg Fern, Warner Thomas at Oxford and so forth, they felt that the better course would be to surge their capacity within the footprint of their existing facilities, and there are a number of facilities, and they have already brought hundreds of ICU beds online across their systems in New Orleans, for example, and that was the better course of action because, Peter, it's not just about the space. The harder part of that is to find the surge staffing. So when you create a hospital outside of an existing footprint, it becomes exponentially harder to find the doctors and the nurses and the lab assistants and the respiratory therapists and all of the people that are necessary to do the staffing because, quite frankly, we only have so many doctors and nurses. And so we did what we did in existing footprint, and then the easiest place and the quickest, because it's not about just what's easy, because we had the surge within a certain timeline, was we set up a medical monitoring station at the Montreal Convention Center, which was easier to do, to create substantial capacity, and it was also easier from a staffing perspective as well. And that was fully coordinated with all the hospitals in the region, especially the larger ones right there in New Orleans. And so, but it's a great question, but it's not as easy as you might think to go back in and just stand back up the charity hospital.
Yeah, no, I expected that was what you were going to say. This is from Trinette in Marrero. How are landlords supposed to make ends meet when tenants quit paying rent and there's nothing landlords can do?
Yeah, and look, I understand that's a tough situation, and the landlords of apartment complexes and so forth, this is obviously a difficult time for them. And one of the things that we've done, in fact, I've personally done it, when I communicate is I say, look, your obligation to pay rent continues. We can't have, from a public health perspective, evictions so that people become homeless when you're fighting a pandemic, because it just makes it that much harder to keep it under control and to slow the spread and make sure that people stay healthy. But the obligation to pay rent continues, and for all of those individuals who can pay rent, they should. And certainly now that the assistance is forthcoming for many more people, whether it's unemployment assistance, whether it's the stimulus check that started arriving, I think, this week in people's, at least my wife told me something got deposited into our bank account. I don't know what it was, but stimulus checks are arriving, and so I am encouraging people to meet their obligations and to pay their rent. And I know that this visits a hardship on landlords, and I hate it. Everything you do, you're trying to balance, strike the right balance between competing interests. And you have to fight the public health emergency and take it seriously. And that means you cannot be having people evicted onto the street when they can't pay, especially when many people are going to be unemployed and unable to pay. And so it's really difficult. I would hope that the landlords are out there, because they run small businesses, that they're taking advantage of opportunities that they have through the Small Business Administration Paycheck Protection Program, if they qualify, which can be a forgivable loan under certain circumstances. And there's also assistance available through the state program of a loan guarantee program that we unveiled a couple of weeks ago. But I know it's a tough situation. My answer probably doesn't satisfy the questioner. I'm mindful of it. It's just there's just not much we can do at the present.
This is from James in New Orleans. Orleans and Jefferson parishes have a COVID-19 infection rate that's 10x the national average. Why is that?
Well, I would be guessing, and I'm going to offer a guess, but I'm just going to make sure people understand that this is a guess on my part. If you look at the concentration of so much COVID-19 in Orleans and Jefferson Parish, and you go back and look at when the first positive case was confirmed through a test, that was 13 days after Fat Tuesday, after Mardi Gras. We know that about 1.5 million visitors came to the New Orleans and Jefferson Parish area in the week or 10 days prior to Mardi Gras, Fat Tuesday, and I can only assume that some of those people brought in the coronavirus and seeded it throughout that community. And there's not, if you just think about all the things we're trying to avoid right now, and that is crowds, and you want people to have good hygiene and so forth. Well, Mardi Gras is not a very good setting for that to happen. But Peter, I would also tell you that there's a second theory out there, and there's a lot of people in New Orleans and Jefferson Parish who leave during Mardi Gras. They go to Colorado to go skiing. They go to New York. They go to Disney World. And they went out and potentially contracted the virus where they were and then brought it home and continued to spread it as well. Now, these are theories right now because we certainly don't know, but I would have no problem if there was some sort of a study that seemed to validate the theory. I would accept it as true. I do want to offer this statement because this has been brought up and it wasn't part of your question. At no time prior to Mardi Gras did any official, doctor, scientist, government official at the federal level or otherwise suggest that Mardi Gras be canceled. And in fact, if you look, the Super Bowl was held just prior to that. We had tens of thousands of people that went to Kobe Bryant's memorial service that wasn't canceled and so forth. And the word at the time coming out of the federal government, the CDC, was the risk to the American people was low. And it wasn't until sometime after that there was the first inclination or first idea given by people that we should be canceling events.
Okay. This is from Patricia of New Orleans, and there are a lot of questions like this. I've tried dozens of times at different hours of the day to file for unemployment. Mm-hmm. Either the website is paralyzed by the number of people filing, or there's some sort of glitch. I've submitted questions to the site via email and have not received a response. Meanwhile, I'm unable to pay my bills for the next month.
Mm-hmm. Yeah, gets back to one of the questions I answered before. Mm-hmm. We have expanded the number of people who are working, mm-hmm. the hours that they are working. We've expanded the volume of calls that we can take and the volume of traffic that we can accommodate on the website. Having done all of that, it still can be very frustrating, and I apologize to everyone. I'm just going to ask them to be patient, be persistent, to continue to try. Whatever you can do online, do it online and do it between 10 p.m. And 5 a.m. when the amount of people who are trying to access the system is the smallest. And then we do need people to not just submit their initial claim, but also their weekly recertifications, because that's required by law, by federal law, for them to continue to receive the payments. And we're going to continue to make changes that improve the system. We are not outliers, as you can imagine. This is happening in every single state, and I don't offer that as an excuse. But this is a volume of claims that we have never seen before by a factor of several times. And so we are ramping up all of our capacity to handle these claims, but we're not there yet. And so I'm just asking for people to be patient and be persistent. And again, we're the second state, and we're one of two states paying the $600 right now. And so there are certain things that we're doing well. We're doing well, and I want to thank all of the people at the Louisiana Workforce Commission for the work that they are doing.
Right. I did read that you've hired, up from like 25 people to like 300 people or something like that.
Yeah, and not necessarily hired them. So they may have been working at the Workforce Commission already, but they were working in different areas, and so they've been brought to supplement this particular group that typically handles our unemployment claims, and so that's what we've been able to do, and quite frankly, we're going to continue to surge, and we're looking for new and better ways to to make sure that we can take care of these claims. And by the way, I'm also looking forward to the day when people don't need this unemployment assistance because they're back at work and our economy is flourishing again.
Okay. All right, this is from Ben in Thibodaux. Why can't hairdressers and barbers open by appointment only?
Well, it's not so much whether there's appointment or not. These are forward-facing personal services and have a really higher risk than most of spreading the virus. And so when we're in our main effort, our stay-at-home effort to fight this virus, when we're doing what we can do as a state to match the call coming from the president and the vice president, that 30 days to stop the spread. All of the CDC guidance specifically pointed out things like tattoo parlors and beauty parlors and barber shops and nail salons as the types of things that we needed to close. And when they do reopen, there's going to be some limitations. And the appointment may be helpful because you're not going to want people sitting in a waiting room in close proximity to one another. They may need to temperature check people, and the people providing the service and the customers may need to wear a mask. And so forth. These are precisely the types of people that shouldn't be working while they're sick. And so if they're sick, we're going to ask them not to do that. I understand the hardship that this is putting on them. And we hope to be able to ease the restrictions as soon as possible with the necessary precautions in place. And we're going to do that as we are able and consistent with these guidelines that I'm holding in my hand that we haven't yet had an opportunity to go through.
Okay, another question. Since Lowe's and Home Depot are selling garden plants with people moving around the nursery unrestricted, why can't churches cordon off every second or third row of pews and enforce social distancing, as well as control entry and exits and be allowed to resume Sunday services?
Well, I'm looking forward to being just like we're talking about the salons and so forth. I'm looking forward to being able to ease the restrictions on the size of crowds that can be in a particular venue. And we're looking for ways to do that where it can be safe. What we know is that, quite frankly, there is not a setting more conducive to the spread of the coronavirus and COVID-19 than your typical worship service where you have many people sitting in close proximity for an hour, hour and a half, 2 hours at a time, and you have many members who are older and in the vulnerable population because of chronic health conditions and so forth. And so as we knew that we had to battle this like a war and stop the spread and flatten the curve, quite frankly, it just wasn't an option to leave to exempt houses of worship. That is not an easy decision to make. I mean, that's very tough. It was very tough for me, someone who I'm certainly a Christian, a Catholic Christian, and I go to Mass, and I think it's critically important. But at the same time, we needed to do what was necessary to protect public health and get through this emergency. We are going to be, just as we're going to be making changes with respect to the way restaurants function and office buildings and other venues, we are going to be easing the restrictions and there will be more people who will be allowed to go to worship services once we get through this. And we're looking to see exactly what that's going to look like. But I can tell you, it is going to require the churches to take a lot of accountability upon themselves to ensure social distancing and to ensure that proper hygiene and that the pews get cleaned frequently and that they're going to be asking people not to come if they're sick, that they're going to be especially messaging to parishioners that they might have who are vulnerable because of their age or chronic underlying conditions and so forth. But in that initial effort that we had to make, again, Peter, we had the fastest growth rate in COVID cases in the world, according to Johns Hopkins data. That was just a month ago. And so you have to take actions that are commensurate with the challenges. And the churches were just part of that. And that's just the unfortunate reality. wasn't something we wanted to do, and we're looking at ways as we re-engage the economy going forward. And by the way, this is not now. It's not next week. It's sometime after the expiration of this order that we're currently going through on April the 30th. I need people today focused squarely on continuing to abide by the stay-at-home order, maintain social distancing, wear a mask when they're out, stay home if they're sick, and engage in proper hygiene measures so that we can continue to slow the spread, flatten the curve, and put ourselves in a better position to reopen the economy.
Okay, this is from Kathy of Prairieville. Says, you continue to tell us that we should social distance, and yet you allow Tony Spell and his congregation to ignore you.
Mm-hmm.
Why are you allowing him to ignore you?
Well,
And the others who go to ignore you.
yeah, and look, I know that he's the one that's drawing the most attention. The fact is, we have well over 4,000 churches. I suspect that there are others out there as well, but he's unfortunately chosen not to be the leader that I would have hoped he would be, because leaders, whether they come from the business community, the faith community, whether they're elected political leaders, when you have a public health emergency, we need leaders who are focused on health and the health of whoever it is that they are leading. That's not the path that he has chosen to follow. But one of the things that you have to consider is not just the initial action that you take, but what are the second and third order effects of that? And by that, I mean, it was clear to me that with over 4,000 churches, tens of thousands of businesses, 4.7 million people out there, we're not going to enforce our way out of this. We're just not going to do it. But secondly, you run the risk through an enforcement measure of actually providing the individual that you're trying to enforce the stay-at-home order on. You give them a bigger platform to use, and then you potentially have protesters showing up in great numbers, and then you have a law enforcement problem and a public health problem, and so we just and by the way, I've supported the efforts that the district attorney in East Baton Rouge Parish did make, because I know that a summons was served on the pastor, and I want to use this forum again today to urge him. I'm appealing to him to stop what he's doing, because he is putting his parishioners at a greater risk for contracting this virus. We know that this virus is much more contagious than the flu. We know it is much deadlier than the flu, and we are still in a stage here in Louisiana where we're very much focused on flattening the curve, and I would appeal to him again to stop what he's doing, and then if he won't, I'm going to appeal to his parishioners to stay home. They have obligations as individuals too. This is a lawful order. I have no doubt that we're in a public health emergency that was declared by me, and by the way, that was backed up by a declaration that came from President Trump as well, and that confers upon me the authority to take the actions that we've taken. I have no doubt that they're legal, they're appropriate, they're necessary. And I would encourage Pastor Spell and all of his parishioners, and by the way, everybody else out there, to do what they can to abide by these orders.
Okay, this is from Kaya in New Orleans, and she says, I would like to thank you for the incredible job of keeping Louisianians informed amid this COVID-19 crisis. My question is, why is the state conducting checks of abortion clinics?
I'm sorry, why is
The
or
state
isn't?
conducting checks of abortion clinics.
Well, first of all, we've done checks of numerous clinics of different types. One of the things that we needed to do when we're surging our medical capacity was to make sure that we weren't engaging in non-emergency medical and surgical procedures, so that you can conserve PPE that can go to the frontline healthcare providers, nurses and doctors and so forth in our hospitals. We also knew that was essential in the overall effort to slow the spread of COVID-19, because much of this is spread in medical settings. So we issued guidance, or order, I should say, out of the Department of Health to that effect. Dr. Guidry did that. It wasn't just aimed at abortion clinics. It was aimed at all healthcare providers of these types of services. So whether it's a surgical center, it could be an orthopedic clinic, and by the way, none of which were closed by the order, but the types of things that they could engage in were limited. And so it wasn't something where we were just focusing on abortion clinics.
Okay. This is from Candace. I'm sorry, this is from Candace in Metairie, although I don't know why that. I'm sorry, this is from Spencer in Tangipahoa Parish. The DMV in Tangipahoa Parish is closed down. I have a vehicle that needs a tag as well as license plates, and where can I go to get one?
Well, that's a great question. I don't know the answer as I'm sitting here, and I don't know exactly how to get a hold of Spencer to get him that information. But I would like very much to be able to send that information to him. Okay. And by the way, the Office of Motor Vehicles in Tangipahoa Parish, that closure happened before the COVID-19 situation. There was a problem with the building that they were in. I believe that there's still some curbside service that may be available through the Office of Motor Vehicles, and I will try to get that information to him if you can provide.
I can provide you all with
you
I
do
can provide
have
your staff with the email.
Yeah, if you will,
Yeah.
I will
Okay.
have someone from the Office of Motor Vehicles contact Spencer to get him that information. I do want to take this time though to talk about that. Even though the Office of Motor Vehicles is closed to the public, you can renew your driver's license through the LA Wallet app. The app itself is free, and there is a cost, as there always is, for renewing your driver's license, but the $18 convenience fee is being waived. And so you can download the app for free. You do not pay the $18 convenience fee. You will just pay the cost that you would normally have to pay to renew your driver's license. Of course, every other time that you renew your driver's license, you have to go in and have your eyes checked. So it's not going to be available for everybody, but there are an awful lot of people who can take advantage of this. And for the people who can't take advantage of it, then there's not going to be any penalty associated for having a driver's license that is out of date until after 30 days expires or elapses from the end of the public health emergency. So I just want to make sure people understand that.
Okay. Are you all enforcing, the vehicle inspections? Is that going on? Do you know?
Well, I don't want to speak for all of law enforcement out there. I can tell you, generally speaking, law enforcement is not trying to do things that would bring them into contact with the public unnecessarily or bring the public into contact with them. But we do need people to be safe. And I know this is not the question you just asked, but it was reported to me this morning by Colonel Reeves, the head of the state police, that we've actually seen an uptick recently in the number of fatal crashes across the state of Louisiana, even though the volume of traffic is way down, which suggests that people think that with fewer drivers on the road, that the ones who are, they can drive faster. Okay. But all of the rules of the road still apply. All of the traffic laws, and especially speed limits, they do still apply, and we do have law enforcement out on the road for those reasons.
Okay, Matt of New Orleans says, will Catholic schools be able to hold scheduled graduations en masse at the end of May?
I don't know the answer to that. And if there may be some crowd limitations, that size limitations, and it would sort of depend on the facility that they're in, how big the facility is. I don't think you're going to see graduation ceremonies at the end of May that would look like they looked in May of 2019. But I'm going to ask him to be patient because we're going to be issuing guidance on that later this month as the current proclamation executive order expires on April the 29th. It will be replaced. And by the way, you're going to have individuals and entities that will also put rules on themselves. And so it won't just be a function of what my order does. It's going to be a function of what that particular Catholic school chooses to do.
Okay, this is from James of Shreveport. Why are some people getting $600 a week on their unemployment checks retroactive to the week ending April 4th, and some people receive payments for only one of the weeks?
Well, first of all, that is a function of federal law. It was in the CARES Act. And I can't answer that particular question. I can tell you it's retroactive to as far back as the week ending April the 4th, provided that the individual during that week qualified for that unemployment benefit. If the individual wasn't unemployed until the following week, then he or she may only qualify for 1 week of the $600. So everybody's situation is different, and it's hard for me to give blanket responses right now. But as a general matter, the $600 a week is retroactive as far back as the week ending April the 4th. Those who qualify for it can get it. And by the way, it wasn't possible in some situations to issue a check with $1,200 worth of benefits. That doesn't mean that the second $600 isn't going to show up. And so it could be, and I hope for the benefit of this individual who asked the question, is that there will be another check coming with $600 in it to make that benefit fully retroactive for both of those weeks. But I don't know if he qualified for the first week or not, and so I can't guarantee that.
Okay. This is a theme in a lot of the questions. Were you surprised when the reviews of the data revealed the racial discrepancies in the death rates? You may have been briefed earlier, so you may have understood it earlier.
Yeah, well, the answer is yes. And I was surprised and disappointed. I know it's something that we're having to take a look at both in the short term so that we're more effectively communicating with these individuals who are especially vulnerable to this disease, and that also so that over time we can reduce these disparities so that when this happens again, hopefully it never happens again, but whether it does or doesn't, we want people to be as healthy as possible. So I was surprised that African Americans are dying at twice their percentage. So in the state's population, they're about 33%. They're over 60% of the deaths in our state. Now, I've always known that they have more of the comorbidities on average, and in the African American community is what I'm trying to say. And so I would not have been surprised, disappointed, yes, but not surprised had we seen that more than 33% of the deaths were in African Americans. But the fact that it's over 60%, that really did surprise me. And what I've learned since we were the first state to report on that, by the way, here in Louisiana, what I've learned since then is there are other places where the same thing is showing up, Milwaukee and Detroit and in other places. So we have a lot of work to do. That's why we created a task force to really study this and try to better communicate. And by the way, it's not too late for individuals, whether they're African American or not. We know that you're more vulnerable if you have hypertension, diabetes, kidney disease, heart disease. Well, don't just accept that, because right now you can do things that make you healthier, even though you have these comorbidities. Take your medicine. Watch your sugar intake. Watch your salt intake. Do what you can in order to be as healthy as possible, despite the fact that you have this condition, so that in the unfortunate event that you do contract this disease, you're in a better position to fight it off. Incredibly important that people do that.
One of the things that Senator Cassidy said when I visited with him last week was that it may be that the reentry to work and those kinds of things would be structured in a way that favored younger people or people who don't have those health conditions. And I thought at the time that people who are older and do have those health conditions might not like that idea and might be worried about being, displaced in a recessionary economy when, I'm not allowed to return to work, but they let a younger fellow return to work, and then eventually they figure out they can get by like that. Do you think that that idea has any practical application?
Well, it's not something that I thought about until you just asked the question, and I don't know that that's going to play out. We do know or we expect that antibody testing is going to inform a lot of the decisions that are made, and a big percentage of young people who've had the disease had relatively few, if any, complications from it. Some may have remained completely asymptomatic throughout, or had mild symptoms, but yet they developed the antibodies needed to confer some immunity on them. So they're going to have a better ability to resume work and other activities. But I can tell you this, it's very clear in this Opening Up America Again guidelines that came out today from the White House that they were asking us to always do things to take special care with respect to those individuals who are most vulnerable by age or by chronic health condition. I do hope it doesn't mean that people can't go back to work, but I can tell you this. If you're over 65 and employed, or if you've got these chronic health conditions, it is much better if you can work from home that you do that. And if you do have to go to work, you've got to make sure that you're following social distancing, wearing the mask, asking people in close proximity to you wear the mask, and make sure that you're following the hygiene practices.
Okay. This is from Mike in Woodworth. Do you know, I'm sorry, it's from Karen in Metairie. Do you know how long the travel restrictions will be in place in Texas and when those checkpoints will be removed?
No, I can't tell you that I know that because it's not something that I'm in control over. And I don't know, I guess you could characterize them as travel restrictions. It's my understanding that no one is said that you can't travel into Texas at those checkpoints. But if your destination is in Texas, they're telling you that they expect you to quarantine there for 14 days before you go out and about. And if you're just traveling through Texas, you're allowed to do that. And there are some essential services and infrastructure and workers and so forth that are not being placed on the quarantine program either with respect to the 14 days. The last I checked, the way this was working was that they were on the major routes into Texas, and such as Interstate 10, Interstate 20, pulling over somewhere between 5 and 10 cars at a time, regardless of what states they were coming from, by the way, not just from Louisiana. And while they're talking to those particular drivers, then all the rest of the traffic is just flowing through as normal. And then they'll go back out and pull 6 to 10 more over or something like that. But commercial vehicles are not being stopped at all.
Yeah, we sent Brooks Cabina, actually went over there to see, what was actually from Houston, went over there to see, and that was kind of what his experience
Yeah,
was.
and I think that's still the way they're doing it. So I think it's probably fair to call it a travel restriction, but there is no real restriction from people going to Florida. But there is an expectation that you're going to quarantine if you're going to go there to stay.
Okay. Katie of New Orleans says, if the Louisiana Senate and House do not vote to accept the Secretary of State's emergency election plan, can the governor use his emergency authority, that's you, use his emergency authority?
Well, we've used the emergency authority that I have to reset the election dates and to which now going to be on July the 11th for the primary, August the 15th for the general election, and then to change qualifying periods as well. Quite frankly, I don't believe that I have the authority under the law to go beyond that, and we needed the legislature to approve the plan that the Secretary of State came up with. As a general matter, I will just tell you, no one should have to decide whether they're going to expose themselves or to others to the risk of contracting COVID-19 in order to exercise their right to vote. And so it's my hope, my expectation that the legislature will work with the Secretary of State, and if they want some modification of his plan, that will happen soon. But people should not be asked to engage in that sort of a decision when it comes to casting a vote. We don't want what happened recently in Wisconsin to happen in Louisiana. And what I can tell you is in July and August, there will be the novel coronavirus in Louisiana. There will be COVID-19 in Louisiana. We won't yet have a vaccine. I don't know whether there'll be an effective therapeutic treatment or not. But we're not going to be fully back to normal. And quite frankly, we shouldn't be having an election as if everything is normal. So I hope that the legislature will get on board, work with the Secretary of State, who's doing the best that he can in order to make sure that we have an election that preserves public health while grants access to the ballot box to our voters.
Okay. This is from Karen in Baton Rouge, and she asks if are COVID-19 patients being administered hydrochloroquine?
Yeah.
And if so, what's the magnitude of it and what's the
Yeah,
success
and
of
I can't speak to the success of it now. I can tell you that I've known for many weeks now that hospitals have a certain protocol, and there are certain patients where it's contraindicated, and they're not going to administer it. And I'm not going to pretend to be a physician here, but the hydroxychloroquine, which goes by the name of Plaquenil, is being administered in many of our hospitals to many of their patients with COVID-19, sometimes in combination with other drugs such as the Z-Pak, the azithromycin medicine that you can get, and then sometimes in a triple cocktail as well. I can't speak to the efficacy of it, but we do know that it was being prescribed, and early on it was being prescribed and used in such numbers that it exceeded the supply that is on hand that's necessary for lupus patients and patients with rheumatoid arthritis and so forth. And so the efforts to greatly increase the amount of the drug that's in the state has been helpful, because it's my understanding that the Board of Pharmacy was able to rescind their emergency rule on this because the supply was replenished to a sufficient degree, and then they just issued some guidance about the prescription for it. But it is being used. I'm not able to say today what the efficacy of it is, but I know that many hospitals and doctors around the state of Louisiana have made that part of the treatment protocol. It remains the case, at least as far as I know it, and things are changing every day. There is not yet what they call a therapeutic intervention for COVID-19, and that means there is not an approved treatment for it. And so everything that they're doing is somewhat of a trial, and it's not proven, but we'll see.
Okay. This is from Ryan of Thibodaux, and this is another thematic question that's come up a few times. Are we labeling as coronavirus deaths people who die of other causes?
Yeah. Well, that's in the death numbers that we're reporting. So for today, it's 1,156 deaths. Mm-hmm. I can tell you that all 1,156 of those individuals had a test result that was positive for COVID-19. Mm-hmm. There's a much greater likelihood that there are individuals who are dying and they're not being tested and potentially died of a complication related to COVID-19, but it's not showing up that way because a test wasn't administered. I don't believe that what he was questioning about is happening. I know it's not happening with respect to the reports that we are issuing. And by the way, that's why sometimes we're reporting a number of deaths, only a fraction of which happened in the previous day or two or three. Sometimes it's suspending back as far as 10 days because we're waiting for the test result to catch up and be reflected on the death certificate.
Okay. This is from Dolores of Shreveport. She says, can I, a 55-year-old black female, get tested for coronavirus for free?
Yes, but when she is symptomatic. Right now, they're not issuing tests to asymptomatic people because the result is not reliable, and you can give someone a false negative and they believe that they don't have it, but they do. They just haven't become symptomatic and they haven't started shedding enough virus to where the test result came up positive, and you give them this false sense of confidence that they can go out and continue to work or whatever, and so you have to be symptomatic. But in the CARES Act, it was specifically approved by Congress and signed into law by the president that no one has to pay, and so if you're uninsured, then they have other ways of paying for that test, and there should not be a copayment or anything for these individuals.
Yeah. Okay, well, those were great questions, but now we've got some stumpers from Smiley Anders.
Uh-oh, here we go.
And as I said at the beginning, Smiley Anders, who's one of the few people at the Advocate who's older than me, there are some people who believe that Smiley actually covered the 1918 pandemic, but he would have to be 120 to do that. So he might look 120, but I don't think he is 120. Did you grow up reading Smiley Anders?
I did.
Okay.
So the entire time in my house, we always subscribed to the Advocate, and one of my jobs as one of the youngest in my household was to make sure that my dad had that paper in the morning, and so we went out into the front of the driveway, got the paper, brought it to him, and I suspect Smiley was been in that paper the entire time I've been reading it.
Oh, that's probably true. So here are Smiley's questions. These are serious matters. It says, Governor, has the unsettled situation due to the virus put any extra stress on your chickens at the governor's mansion? And if so, has it affected their taste?
Well, first of all, I don't eat my chickens. The eggs taste just fine. I don't believe it has anything to do with the virus, but we've had a black fly problem and a gnat problem all along the river in Louisiana, and quite frankly, I've lost a few chickens because they will suffocate, and so we're trying to make sure that we can take care of that, and we're trying something today by mixing water and vanilla extract, spraying it on the mosquitoes, and seeing if that keeps the flies away. But the eggs that I am getting taste just fine, and I'm actually going to replenish my stock. I've got a few young hens that I'm going to buy and put in there with them. But I appreciate him asking about my chickens, and it just so happens we're having some problems right now. But it doesn't have anything to do with the virus.
Coronavirus. Okay. Well, I know that they had I think a tiger in New York was found to have coronavirus.
Is that right?
Yeah, and so we get a lot of questions about people about whether their pets can get coronavirus and all that.
And I refer all those questions to Mike Strain, because he's a veterinarian and the commissioner of agriculture and forestry. And by the way, that is something that he's keeping up with.
Okay. Well, they put a fence around Mike the tiger. I don't know if you knew that. So now you have a glass that protects Mike the tiger, protects us from Mike the tiger, and we have a fence that protects Mike the tiger from us.
Yeah. Well, look, that's sort of the thing behind the mask. The CDC recommends masks now. And Peter, if you wear a mask, you're protecting others from yourself. And then it's always helpful to look out and see that they're being as courteous as you are and protecting you from them by wearing a mask as well.
Okay. Well, so this is Smiley's. This is the last question from Smiley. It says, Governor, has there been any concern about Mike the tiger catching the virus? In addition to the measures already taken, should he wear a mask? And if he should wear a mask, which Republican would you appoint to put it on him?
Well, first of all, I would hope that we're making sure that no Alabama fan is getting close to Mike the Tiger right now, because they might intentionally try to see whether they could give our tiger COVID-19. No, that is a very funny story and or question, I should say. In all seriousness, I do hope that this fall the LSU Tigers are going to be able to defend and successfully their title. I suspect they will be able to do that. Don't know what the games are going to look like in terms of the crowds and all that sort of stuff. But in the meantime, I hope that other LSU fans in the state and out of state are doing what I'm doing, and that is when I do find myself at home late at night and I've got some spare time, I'm watching the games that I taped. I taped every single game last year.
Oh, did you? Really?
I have,
Okay.
and I've watched them all more than once now, and I find that to be extremely entertaining. It excites me. It's one of the reasons that I'm really hoping we can get past this coronavirus sooner than later and get back to enough normalcy that we can be in Tiger Stadium watching them beat Alabama in Baton Rouge this year.
Okay. Well, the good thing with watching those games is it doesn't matter which one of the 15 you put on. You know how it's going to end.
And we're never going to trail in the fourth quarter, and we're going to win the game.
Yeah. Well, there you go. Well, we appreciate you coming by. You've always been a great explainer, and we appreciate that. And we thank everyone for joining us. Journalism has never been more important to Louisiana at this moment. And if you want to support us and support journalism, we ask you to go to NOLA.com/subscribe. And a digital subscription only costs $2.32 a week. And you can also get the print edition, which I think probably is what you grew up with.
It
and,
is.
Smiley is in there 6 days a week, and he still is. Anyhow, thank you all for watching, and
Thank you, Peter.
Governor.
Appreciate
Okay.
you.